Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. I am very excited to have on today Igor Klibinov, who is a personal trainer, but much more than that, based out of Canada. He is actually an author of 8 books on exercise and nutrition, 3 of which are Amazon bestsellers. So we're going to be covering that. And he's a he is a CEO of one of the world's premier online personal training companies called Fitness Solutions Plus. So I'm very excited to have Igor on today. He has spoken over 400 times in different engagements to companies. So thank you so much for joining us today, Igor.
My pleasure. Thank you so much for having me here. These are some of my favorite topics to talk about.
Yeah. So tell us, how did you go from personal training to covering topics of chronic condition and disease for humans?
Yeah, it seems like a very natural transition to me just to offer a better service to my clients. When I was starting my career as a personal trainer, well, now 17 years ago, I was working in a community center and a country club. And by and large, the majority of my clients were people over 50. And I would ask them, the usual stuff during the initial assessment. What are your goals? What are you trying to do? And the answer usually was fat loss. And I'd ask a deeper question. Why? Why do we lose body fat? And they would say something deeper, like, I want to lower my cholesterol. I want to lower my blood pressure. I want to lower my blood sugar. So I thought to myself, they're doing the weight loss side of things incidentally for the sake of something else. Now, yeah, they want to look better. There's vanity reasons, which are fine, great. Whatever motivates you to get to where you want to be. But it's not the only thing they want. They didn't just want fat loss, they wanted better health. So I thought to myself, well, how do we accomplish more than just fat loss? How do we do fat loss and blood pressure reduction and blood sugar reduction, etc.? Because it's one thing to exercise for fat loss. It's another thing to exercise for blood pressure or blood sugar reduction or osteoporosis improvement and so on. And so I didn't just want to do the bare minimum. I wanted to do the best possible thing that they could do in that period of time. Because you can spend an hour doing a good thing, or you can spend an hour doing the best thing. I wanted the best thing. So I really wanted to get the best possible results from my clients. No courses existed on that at the time and still don't about how to work with clients with chronic conditions. So I actually had to do my own research and go directly to the source, which is medical literature. I've scoured the studies, the medical journals, etc. So I didn't want my sources of information to be YouTube, Snapchat, and Instagram. I wanted to go straight to the source, the medical literature, and I wanted to interpret the studies for myself. And sure enough, there's actually a decent amount of research on exercise, nutrition, supplementation for the chronic conditions that I deal with.
Yeah. And sometimes you'll get a physical therapist who works with people on that. So how is this different than what a physical therapist might provide? Because physical therapists, sometimes you might say physio, will work in a cardiac setting or work in kind of a general orthopedic setting or other body parts. So how is this different from the education that a physical therapist might receive?
Yeah, you're right. By and large, the vast majority of physical therapists are in the orthopedic realm. So they deal with musculoskeletal issues. And they also use a lot of modalities, things like ultrasound, etc. Where they're not as strong is the exercise side of things, and where they have, as far as I know, very little to no training is nutrition and supplementation. But you get better results when you combine all 3. For example, in some things, exercise is very powerful. In nutrition it takes a back seat. In other things, nutrition is very powerful and exercise takes a back seat. For instance, in osteoarthritis, nutrition does very little, but exercise does a lot. With rheumatoid arthritis, it's the opposite. Exercise does a little bit, but nutrition does a lot. And so for some conditions, physical therapists do a marvelous job. But for other things where exercise plays less of a role, where nutrition is a big part of it, they do an okay role, but not as good as it could be if they combine exercise, nutrition, supplementation.
Wonderful. And so as you went through your journey trying to help your clients even more, you studied the literature. When or how did you start implementing it? Did you start implementing this information on your own? Did you test it out? How did that work?
Yeah, so I looked at the studies. As soon as I had my first client with one of these conditions, I looked at the studies and I wanted to figure out, how do you exercise for that condition? How do you eat for that condition? What supplements work for that condition? And then I tried that with my clients. If it worked, great. I tried it with other clients who had that condition. If it didn't work, I went back to the drawing board and tried to figure out why is there a discrepancy between what the research is showing and what I'm seeing with, well, at least this one client?
Yeah.
Again, one client is not huge representative, but I wanted to get better results for that one client.
Mhm.
So if it worked, I would try this with other clients. And once I had, 7, 8, 9 people who this worked with consistently, I would actually teach that system to my trainers, to my staff, and they would try it with their
Mhm.
clients who had those conditions.
Right.
Once we had between all of us a few dozen success stories and case studies where it worked, I would write a book about it. So each
Okay.
book is backed not just by research, but actual work with clients who this worked for. In each one of my
Excellent.
books, there's always a chapter about a case study. Here's one client, real
Mhm.
person, and here's what we did. Here's the exercise, nutrition, supplementation strategies that we used with this person.
That's excellent. And now, where did you get the information on the supplementations? I don't know about where you're at, but there's always the controversy. Do supplements really work? Are you just, paying for expensive urine, that type of thing? What is your take on it? Obviously, you believe in them, but like, how do you approach it?
Yeah, I got the information in the same places I got all the other information, medical journals. And so I actually, there's an entire chapter in each one of my books about supplements. And the first part of the chapter is always myth busting the myths about supplements. One of those myths is that if you have a healthy diet, you don't need supplements. And
Mhm.
that's conditionally true. If you have a healthy diet, for a lot of people don't need supplements. But there's a difference between maintenance doses versus therapeutic doses. So for example, to bring somebody from deficiency to sufficiency, maybe food is not enough. To bring somebody from, let's say, from sick to healthy requires a lot more. Case in point, vitamin C. Just to
Mhm.
have a good nutritional level of vitamin C, you need about 60 milligrams per day. That's not very much. You can get that out of, French fries. That's not, it's very little. Um, for heart health benefits, we need between 500 and 1,000 a day. Now we need some, better sources of vitamin C, things like
Mhm.
kiwis, oranges, blueberries, etc. Now, if you're sick, you might need between 2 and 8,000 milligrams per day. Now you just can't get that out of food. The single
Mhm.
richest food source of vitamin C is actually orange bell peppers. Those have about 183 milligrams per pepper. So how many peppers do you need to eat to get the 2,000 milligrams? Too many.
Way too
Um,
many.
yeah. So that's one misconception, that if you eat a healthy diet, all you need is, you don't need supplements. Misconception number two is supplements don't work. Um,
Mhm.
and to say that would be essentially would be akin to religion. There's a mountain of evidence showing that it works, and you choose to close your eyes saying it doesn't work. How do we see this evidence? Well, there's tens of thousands of studies on different supplements showing that in the situation it works. Now, that's not to say it works in every situation. It's
Yeah.
not to say that every supplement works. So in every book that I write, there's a supplement chapter, and this chapter is divided into 3 sections. Um, Section 1 is proven. We know this works in people. And the reason I say in people is because there's a lot of stuff that works in mice, rats, or petri dishes, but has never been studied in people. Um, the second section is unproven. There is no research backing up whether it works or doesn't work. And the third section is disproven. We know whether or not it works. It doesn't work. So only about 30 to 35% of the supplements on the market that say that they do something, they actually either we don't know or we know that they don't work. So to say that supplements are completely ineffective is absolutely wrong. To say that all supplements are effective is also wrong, because the truth is really somewhere in the middle. Some supplements
Yeah.
are effective, the majority are not.
Yeah. And I don't know if this is outside your realm, but there are more tests that are coming out to look at what we're deficient in. Do
Yep.
you ask people to get those testing done before you recommend a supplement, or the supplements that you're recommending, is it kind of just general for a condition?
Um, it's it's general for condition. There
Mhm.
are tests that we like to use, such as we do, such as we don't. I'm a big fan of the good old underrated blood chemistry.
Mhm.
There are some fancy tests out there. There are urinary organic acids profiles. They've been shown to not be terribly accurate. There's a Dutch test, and that's not terribly accurate.
Mhm.
But the good old standard blood chemistry has been validated many times over, and so on. So I really like that one. The
Okay.
other thing I like to do is to go by symptoms. Symptom analysis goes a long
Mhm.
way. Asking a great history goes a long way.
Mhm.
Um, and of course, there are some general things that work for that condition. I like to refine the general recommendations with what do we actually see in this client. For example, We know that that magnesium often helps with high blood pressure. But let's say we give a client magnesium and nothing happens. But unless we measure their blood pressure, we don't know. So we have to refine what works in theory or what works for large groups of people. Does that work for that individual? And if it does, great, keep it up. If it doesn't, well, let's either dump it or change the dose and then try again. So yeah, it's a combination of symptoms, that condition, and on occasion blood work.
Okay, that's wonderful. Okay, so obviously your topics are obviously fitness and then looking at nutrition as well as supplementation. And those kind of three topics kind of form the basis of your program when you're working with someone and helping them with chronic conditions. Is that correct? Did I miss anything?
Yeah, good summary.
Okay. So can we go through, I know for your Amazon bestsellers, the big topics were high blood pressure, diabetes type 2, and osteoporosis. Do you mind if we cover a little bit on each of those topics? Obviously, we want people to go read your books and get all the details. But if we cover a little bit about each of those, would you mind if we go through that?
Yeah, absolutely.
Okay.
I love talking about stuff. Let's do it.
Okay, so high blood pressure. That's a big problem nowadays. I mean, my brother who's in his early 40s is even in his late 30s, he even had it. So it is a big problem. So let's go through kind of what are some of the common things you see with it? What are some of the myths out there and how to fix it? All that.
Yeah. I love myth busting, so I'll start there.
Yeah.
One of the myths about high blood pressure is that if your parents had it, you have to have it. Genetics play a role, but genetics are not destiny. There's a saying that genetics load the gun, but environment pulls the trigger. Okay. In other words, genetics are like on-off switches. You might have a gene for high blood pressure, but if that light switch is turned off, as long as the environment doesn't reinforce high blood pressure, you'll be fine. But if you have the gene for it and you have the environment for it, and I'll discuss what the environment is in a second, then you likely will have hypertension. For a lot of people, genes are just inherited environment. If you live the same lifestyle that your parents and siblings and grandparents live, then you probably will have the same thing. But if they lived a certain lifestyle and you live a different lifestyle, a better lifestyle, then you probably won't get it. I'm never going to say definitely, but in all likelihood, you probably won't get it. And what are the right conditions for hypertension? Well, let me distinguish between two major types of hypertension. One is called primary hypertension, and that is about 90% of all cases of high blood pressure. And primary hypertension just means that it's a lifestyle condition. It's due to nutrition, it's due to exercise, due to sleep, due to stress. Then there's something called secondary hypertension. Secondary hypertension means you have high blood pressure secondary to a different condition. For example, hyperthyroidism can cause also hypertension. Certain medications can cause hypertension, etc. Kidney failure can cause hypertension, and so on. So there's secondary hypertension, but that's only about 10% of cases. So we're really talking about about primary hypertension. So what is the environment that produces hypertension, primary hypertension? And it's a few things. One, it's a diet high in processed foods. Now, this is almost cliche to say you should eat a natural, whole foods based diet. But let's get more into the specifics. What makes a processed food diet so bad? It's really only three things. One, high sodium. Two, low potassium. Three, low magnesium. In other words, I don't want to make people think that nutrition is a religion. There's no such thing as good or bad. There's only is it good for you at this time in the context of what else are you eating? In other words, is pizza good or bad? If that's all you're eating, that's pretty bad. But if you're eating, salads the majority of the time, and then every month you have a pizza, that's not that big of a deal. So no food by itself can actually tell you how good or bad a diet is. You need to see like a long list of what they're actually eating. And so that's what makes hypertension, that's the nutrition side of things. The exercise is simply being sedentary. Now, yes, there is a specific way to exercise for high blood pressure, and I'm happy to get into that if you want. But as long as somebody is exercising 4 or more days per week, they usually have their bases covered. And a lot of people say, I exercise, I do gardening, I walk 10,000 steps per day. That's good, but insufficient. Walking is good, but it's not cardio. Walking is just locomotion. What makes something cardio? Well, the intensity. You have to cross a certain intensity threshold for it to be cardio. And that
Right.
threshold is 65% of your maximal heart rate. Anything below that is not cardio. Not to say it's not beneficial. It is. Walking is fantastic for you, but it doesn't improve your cardiovascular health unless you cross the 65% threshold. And so that's the exercise, that's the nutrition. Sleep is a seriously underrated factor in high blood pressure. In fact, in the general population, sleep apnea is only about 4%. Only 4% of the general non-hypertensive population has sleep apnea at every age. In the hypertensive population, it's like 58%. It's very high. That's just regular hypertension. Then there's a category of hypertension called resistant hypertension. Resistant hypertension is when somebody is already on 3 medications for hypertension and they're still not lowering blood pressure. In that population, like 83% of those people have sleep apnea. And when these people get tested and treated for sleep apnea, blood pressure goes down without a change in medications. So sleep is of paramount importance. And lastly, stress management. I could go into a whole lecture on stress management, but suffice it to say that if somebody's under stress and not handling it properly, that could be a cause for hypertension. And again, I say not handling it properly, not just under stress, but under stress and not handling it properly. In other words, if they're under stress and they have good stress management techniques and strategies, that's fine. But if they don't have those strategies, then that's also a risk factor for hypertension. And they all go hand in hand. You're under stress, so you don't eat well, you feel like skipping exercise, you don't sleep well because your mind is racing. So everything goes hand in hand.
Yeah, absolutely. And I'm curious, you had mentioned a little bit about exercise, and is there a specific exercise other than something like running, or do you just find something that the person likes to do that you recommend?
Yeah. In terms of exercise, there needs to be specificity in exercise prescription. In other words, as personal trainers, what do we need to know to properly prescribe exercise? Well, it's kind of like there are parameters to prescription, both medications, supplements, and exercise. In terms of medications, those parameters are the dose, okay, how much do you take, the name of the medication. You wouldn't give a statin for something else. You wouldn't give a beta blocker for something else for not high blood pressure. So you need the right medication, the right dose, whether you should take it with food or away from food, morning or evening. So those are the 4 parameters of prescribing medications or supplements. There are also parameters to exercise prescription. Those parameters are the frequency, how many days per week, the intensity, how hard, the duration. When it comes to cardio, that's how long. When it comes to strength training, that's how many sets and reps, and the type, cardio, strength training, stretching, or breathing. So those are the 4 parameters of exercise prescription. And so both cardio and strength training work for different reasons and for different durations. With cardio, in terms of the frequency is less important than the absolute amount. And the absolute amount is 150 minutes per week. Okay, so that could be 3 days per week of 50 minutes, 5 days per week of 30 minutes, or any combination in between. The type doesn't matter at all, whether you're running or cycling or swimming or rowing, doesn't matter. In fact, from an orthopedic perspective, it's actually better if you diversify it, so you don't wear out the joints. So that's your exercise prescription for cardio. With strength training, it's different. With strength training, we want somewhere between 8 and 20 repetitions for a weight that you can lift somewhere between about 11 and 25 repetitions. So you want to stay far enough away from muscular failure is to not elevate the blood pressure too much. The frequency for strength training is 2 to 3 days per week. But here's the cool thing. Here's the big difference between cardio and strength training. Cardio is more like medications in a sense. In other words, if you don't take a medication one day, it doesn't matter if you've been on that medication for 10 years, your blood pressure will go up. Same thing with cardio. The effects of cardio only last about 24 hours. And so you could have been doing cardio for 10 years. The day you stop is the day your blood pressure goes up. With strength training, that's not the case. You can stop for about 3 months and your blood pressure still stays down. That's not to say you should stop, but I'm saying that you can stop. For up to 3 months and blood pressure will still be down. So yeah, there needs to be specificity in exercise prescription. And just because it's good for strength or weight loss or diabetes doesn't mean it's good for high blood pressure. And so here's an example of a specific prescription for high blood pressure.
That's great. That's wonderful. And sometimes you hear people like sway one way or the other with cardio versus strength. And it's good to have both. It really is. I mean, our body is not just one or the other. It's good to have both because they both provide the benefits, and obviously they both help with blood pressure situation. So very, very nice.
Yeah. Cardio
Yeah.
has benefits that strength training doesn't have, and strength
Yeah.
training has benefits that cardio doesn't have. They're both good for different reasons. And why can't we all just get along?
Yes, exactly. We are not just one piece, we're multiple. So,
Yeah.
okay, that's absolutely wonderful. And one of the things you talked about that stress is a big influence, and very close to stress, not the same thing, anxiety.
Yes.
And you have mentioned that there are two common drinks that people consume that make anxiety worse. Do you mind touching on that just for a second?
Yep. The biggest one is coffee so I should say caffeinated beverages.
Yeah.
So that is coffee, and even worse is energy drinks. Those are probably the two worst drinks for anxiety.
Mhm.
Now, having said that, people shouldn't say it's bad for anxiety, therefore it's bad. No,
Mhm.
there's no such thing as a good food or a bad food. There's only the right food for the right person at the right time, and likewise, the wrong food for the wrong person at the wrong time. Caffeine is good for some things, and it's bad for other things, and it's neutral for a bunch of other things. But for anxiety,
Mhm.
it's a distinct negative.
Yeah, that's yes. And just caffeine in general does have some effects on healing. So it's always good to really check in with yourself and see what your situation is before you do things. Now, let's go into diabetes. So we're specifically talking about type 2 diabetes, correct?
Correct.
Okay. So what are some of the common things that you see with that in terms of exercise, nutrition, supplementation?
Yeah. What I see with people who become diabetics is, well, the absence of good exercise, good nutrition, good supplementation. But in terms of what should they do from an exercise nutrition supplementation perspective to make the diabetes better, from an exercise, the exercise prescription is quite a bit different than it is for high blood pressure. The intensity is different. With high blood pressure, you don't want to do high intensity. You want to do moderate to low intensity. With diabetes, you want to do high intensity. And how high is high? It is 85% of your maximal heart rate or higher. Okay. Now, if somebody's listening or watching and they're wondering, well, what's my maximal heart rate? Is 220 minus your age. That's the generally accepted formula. And so that's kind of how you calculate things. So if you want to cross 85%, and let's say our viewer here is 50 years old, so 220 minus 50 is 170. So you take 85% of 170 and you end up with about like 143, 145, somewhere there. So you need to cross 145 beats per minute for diabetes. And that way you're going to have the best possible effects on your blood sugar. Now, again, we want to know frequency, density, time, and type. So the type, of course, is cardio interval training. The frequency is about 3 days per week. The intensity, we just covered that, 85%. And the duration, since it's interval training, somebody would do this intensity, 85% or higher, for between 1 and 3 minutes, and then they would recover. The literature goes by duration, but I prefer to give my clients recommendations based on their pulse. That's much more personalized. So I like to tell my clients rest until your pulse comes back to below 65% of your maximal heart rate. Once you hit that under 65%, you can do another interval. It doesn't matter whether it takes you 30 seconds or it takes you 4 minutes. And then how many intervals would you do? Start at about 3 or 4 and then work your way up to between 8 and 10 intervals. And that will take you somewhere between 30 to 50 minutes. So that would be your exercise prescription on the cardio side of things. On the strength training side of things, you want to be doing somewhere between 8 to 15 repetitions. This time, you do want to get close to muscular failure. With high blood pressure, you want to stay away from failure. With diabetes, you do want to get close to muscular failure. And there's a debate in the fitness industry. Should you do full body workouts or body part splits? And again, there's no good or bad. There's only correct application. For diabetes, it's clear that full body workouts are superior because only the muscles worked become insulin sensitive. So if you have a chest and back day, your chest and back become insulin sensitive for the next 2 days. But the other 5 days, they're not very insulin sensitive and they're insulin resistant still. But if you do chest and back 3 days per week, then you become insulin sensitive for a very long time, basically all week long. So that is our so that's our type. So strength training, the intensity, 10 to 15 repetitions, sets and reps, 2 to 4 sets, and the then that covers the entire exercise prescription for strength training. That's exercise. Nutrition, by and large, the conversation has been around carbohydrates, but I think it's a misguided conversation, because if you look at the literature and what elements, what factors have the impact from the greatest impact to lowest impact, simple calories have a greater impact than arguing about carbohydrates. So and I list a lot of the studies in my book, in people who normalize their calorie levels, I don't want to say reduce their calories, they normalize their calories for their body weight or their desired body weight. Their A1C, their blood sugar levels, drop to normal a lot of the time. Not 100%, but a lot of the time they just normalize. Because by definition, if you drop your calories, you also drop your carbs, okay? That is the single most biggest impact. And that can drop A1C by 3, 4, 5%. That's a huge amount. The next most important factor is fiber, not even carbohydrates, but just fiber. Why is it? There's a lot of studies showing that high carbohydrate diets lower blood sugar. But isn't that counterintuitive? Shouldn't carbohydrates raise blood sugar? Here's the difference. We're oversimplifying. We're not distinguishing between high fiber carbohydrates and low fiber carbohydrates. Okay. If you're eating 65% carbs and it's like white spaghetti, white bread, white pasta, white rice, you're not getting a lot of fiber in there, but you're still getting carbs. If you're getting your 65% carbs, but you're eating beans, lentils, peas, chickpeas, stuff like that, you're still getting 65% carbs, but you're also getting a ton of fiber. And that doesn't have nearly the same impact on your blood sugar levels. Okay. In fact, it's beneficial. People who actually get an optimal optimal amount of fiber, diabetics who get an optimal amount of fiber, they can actually lower their A1C by about 2.5 to 3%. So not quite as high as normalizing calories, but certainly higher than arguing about low carbs versus high carbs. And then in those low carb versus high carb debates, when calories are matched, the difference between low carb and high carb is only about 1.5% when it comes to A1C. So it helps, no question about it. 1.5% is impactful, but not as impactful as total calories and total fiber. Okay, so those are by far the three biggest elements. And I know somebody here listening or watching is wondering, what about glycemic index? Doesn't that matter? A whole lot less than we believe. There are the studies are actually fairly equivocal about this. Some say glycemic index matters, others say they don't matter. It doesn't matter. But even for the people who, even the studies that show it matters, the question is, what is the magnitude of the effect? Even then, those that show that it matters doesn't matter by half a lot. It's like 0.5 to 0.75% if it lowers it at all. Okay. And then we can get into the weeds of glycemic index versus glycemic load, etc. But suffice it to say, the glycemic index doesn't matter nearly as much as these top three factors, which again are calories, fiber, and then less than that carbs.
Yeah, and real quick, I was going to ask you about, have you seen some of the studies out there that are looking at how animal products have a contributory factor to type 2 diabetes? And do you have any opinion on those?
Yeah, so there's a lot of studies correlating animal products to diabetes. But as we know in science, correlation is not causation. What we do know is that charred red meat is carcinogenic. Okay, but that's just charred red meat. That's not to group all red meat into charred red meat. By and large, animal products don't really have a causative effect on type 2 diabetes. In fact, they might have a slight indirect beneficial effect on diabetes, because when you eat a higher protein diet, your protein is fairly filling, it fills you up faster. So you naturally gravitate towards eating lower calories in general. That's why protein is also not one of my top 4 factors, because it's an indirect effect. But yeah, by and large, the relationship is correlational and not causational. Whereas with fiber, with calories, with carbohydrates, that's causation.
Okay, that was wonderful. I appreciate you going into that. Thank you. Yeah, so that's great information on type 2 diabetes. How about this last concept of osteoporosis, which affects people when they're getting older? And it's definitely something that even young people listening really want to pay attention to, so you don't have to deal with it when you get older, because once it kind of happens, it's hard to reverse quite a bit of the changes in your bones.
Yeah, absolutely. And there are a ton of myths about osteoporosis, just like there are about high blood pressure and diabetes. But in terms of the three categories of exercise that I recommend for osteoporosis. One, what's the problem with osteoporosis? Well, it's not just bone density. Really, the issue is fracture risk, because bone density is just a test. We don't just want to look good on a test, but still fracture our bones. We want bones to be fractured. So the first type of exercise is preventing fractures to begin with, which is don't fall. So fall prevention exercises, which is all about training your balance. That's one category. The other category is strengthening your bones. And I subdivide that into two categories. To strengthen your bones, you need strength training. It's obvious, but it's different strength training for osteoporosis than it is strength training for muscle size or for fat loss, etc. And I'll go into how it's different in a sec. And then the third category of exercises is jumping. Jumping is by far the most impactful, pun intended, in both meanings of the word impactful, exercise on osteoporosis. However, jumping is also a very high risk exercise for osteoporosis. So how do you get the benefits of jumping without the risks of jumping? And the way you do that is by not jumping at all for the first 6 to 9 months of strength training. While you're doing your strength training, you're doing it correctly, progressively, and safely for those 6 to 9 months. After that, you start jumping cautiously with progressions. The biggest risk of jumping is actually on the downwards part, when your body and your feet hit the ground. So what do? We jump from the floor onto something, but step down. Jump from the floor onto something, but step down. And we will do that for about 3 to 6 months. The next phase is actually go up and down. We actually jump in place. By this point, you will have been strength training and jump training correctly, progressively, safely for between about 9 months and a year and a quarter. By then, your bones are ready to handle it. That's phase 3. And then phase 4 is you actually amplify the downwards part. So you actually step onto something, but then jump off of that and stick the landing. So that's kind of how the 3 categories of exercise for osteoporosis: balance training, strength training, jump training.
That's excellent. I love your progression. It's a great way to get people to build up and do it safely. Very excellent strategy.
Exactly. We want to maximize the benefits and minimize the risks.
Yeah, absolutely. Okay, so nutrition wise, tell us about this calcium and milk and all those fun things that we hear out there.
There is a lot of stuff that is way overrated, like calcium, like milk, like dairy, etc. And like vitamin D. And so for the longest time, the conversation has been, and the commercials on TV have been, drink milk for strong bones and teeth. And here is what calcium does. Calcium makes you look good on a test. Okay. The bone density test looks great when you have a high calcium diet. But again, what's the point of the bone density test? Really, what we're after is not looking good on tests. What we're after is the end goal, fracture risk. So although calcium increases bone density, it does not decrease fracture risk. So what do we do with calcium? We just cheated the test. So if you like dairy, go ahead and eat it and drink it for its own sake, for the taste. Don't do it for the sake of your bones, because it's not going to do anything for your bones. And how do we know this? Well, one of the meta-analyses in my book, they divided women into 4 different groups. Group number 1 consumed less than 400 milligrams of calcium per day. Group number 2 consumed between 400 and 800. Group 3, 800 to 1200. Group 4, over 1200. And the reason I like this meta-analysis is because they looked at fractures, not just bone density, but real fractures, what really matters. And here's what they saw. There was no difference in the number of fractures between the lowest calcium and the highest calcium group. What does that tell us? That again, calcium just makes you look good on a test and doesn't do anything in terms of your fracture risk. So that's calcium. And this is not just one study or one meta-analysis. I list 5 meta-analyses with over 50,000 subjects. So this is pretty well established at this point. Now, what about vitamin D? As with all nutrients, the body is kind of like Goldilocks. It doesn't like too little of anything. It doesn't like too much of anything. It likes a just right. So low calcium low vitamin D is absolutely bad for you. Low vitamin D can result in osteoporosis. So people take vitamin D to get their blood levels normal, but then they keep taking vitamin D and their blood levels become excessive. Okay. And there is definitely a risk to excessive vitamin D levels. One of those risks is osteoporosis. How interesting that both low and high vitamin D can cause a loss of bone density for different reasons. There's one study in my book where the inclusion criteria for the study was people who already had normal blood levels of vitamin D, and they gave them supplements and vitamin D supplements. And then what happened after a year of vitamin D supplementation? Their blood levels of vitamin D went up and their bone density went down. How interesting.
Yeah.
Because so the message with most nutrients, vitamins, minerals, amino acids, etc., to go from low to sufficient is very healthy, very beneficial, etc. To go from sufficient to excessive is dangerous. Sorry, let me rephrase it. Somewhere between harmless or useless and harmful. So, for example, with stuff like B vitamins or vitamin C, etc., if you go from sufficient to excessive, no big deal. With vitamin C, you either get diarrhea or you pee it out. With most B vitamins, you just pee them out. With a couple of B vitamins, if you take them long term, they can cause issues like neuropathy. But by and large, you just pee them out. So, at worst case scenario, it's worthless, but not harmful. But with some things like vitamin D, you go from sufficient to excessive, that does cause problems. One of those problems is soft tissue calcification. Another one of those problems is kidney stones. So just because it's natural doesn't mean it's good to go above natural levels. So those are a couple of misconceptions about calcium and vitamin D. So I'm sure listeners and viewers are wondering, so if calcium is not it and vitamin D is not it, so what do I eat in order to improve my bone strength? And again, I say bone strength, not just bone density. And let me just clarify that. What is the full name of the bone density test? It's bone mineral density. So it measures the mineral content of bone. However, minerals only make up about 40% of bone. What about the other 60% of bone? That is not made of minerals, that's made of collagen. Collagen is a protein. And the bone mineral density test does not test for that. There's a different test for that, and that's called the trabecular bone score. But not commonly tested, and actually fairly new, maybe about 8 to 10 years old, but very accurate test. And if you combine it with bone mineral density, that's a very good combination. So what do you eat in order to improve bone strength, not just bone density, and ultimately reduce fracture risk, which is really what we're after? And the answer is very, very simple. We overcomplicate things so much, and the answer is super simple. It is protein. Simple as that. And people think, should I eat a high protein diet? Well, no, it's not a high protein diet. It's a normal protein diet. It's just that it's higher than what you're currently eating, because what you're currently eating is a low protein diet. And so again, there was another meta-analysis in my book where they actually divided people based on their protein consumption. So group number 1 consumed less than 16% of their daily calories as protein. Group number 2 consumed 16 to 18%, group 3, 18 to 20%, group 4, over 20% of their calories as protein. And again, the meta-analysis looked at fractures, not just bone density. And the number of fractures in the group of people who consumed the lowest amount of protein was about 16 in the duration of the study. The group that consumed 16 to 18% of their calories as protein had the same number of fractures. Where it got interesting is 18 to 20%. Those folks only had 7 fractures over the duration of the study. In the highest protein group, 20% or more of their calories as protein, they had only 5 fractures over the study period. Okay, so the single most important nutrient for bone strength, and again, I emphasize strength, not just density, is protein. So how much protein should somebody be getting? The protein requirements depend on 3 factors: somebody's age, if they're over 60 or under 60. People over 60 require more protein than people under 60 because their absorption is worse. So age, body weight, and activity level. Are they sedentary? Are they doing cardio only? Or are they doing cardio and strength training? So I'm not going to go into each one and break it down into a 9 table, but I'll give you a range. It's somewhere between 1.2 and 2.4 grams per kilogram per day.
Okay. And people can get to more details in your books, right?
Absolutely. As much as I'd like to go into this, we will get a 3-hour podcast.
Yeah, exactly. And that way people can digest it too, because when you're throwing numbers out and someone wants to look at maybe their weight, their age and all that, if you have that in your book and they can go through that and they can find out exactly what they need. So that's really helpful. That's great. This is wonderful. One other thing I forgot to ask you, for the diabetes part, we had talked about nutrition and exercise. Was there any specific supplements that you recommend for people with type 2 diabetes?
Yes. Every supplement for diabetes should be basically what do we want supplements to do? We want supplements to, well, make that condition better. How do we make diabetes better? We can either decrease the spike of blood sugar after a meal, or we can decrease the duration of the spike. So how high should blood sugar go after a meal? And I apologize, I'm going to give you the metric numbers because I don't know the imperial. It's 7.2 milligrams per liter. And what's the duration of the spike? It should be no longer than 2 hours. So if the spike is higher than 7.2 or longer than 2 hours, then that's a recipe for diabetes. So every supplement for type 2 diabetes should be viewed through one of those two lenses. Does it either decrease the spike or the duration? And to that end, only 4 supplements accomplish both effectively. Those are, in no particular order, milk thistle, alpha-lipoic acid, ginger, and aloe vera. There are a lot of other ingredients that claim to lower blood sugar, especially A1C, effectively, but either they don't do it or they don't do it as effectively as these 4. These are the only 4 that I'm aware of that lower it by over 1%. There is another category that's lowered between 0.5 and 1%. One of those is berberine, very commonly recommended, but not as powerful as the previous 4. And then there's a bunch of supplements that claim to do it, but don't do it very effectively, like cinnamon, not as effective, doesn't lower it by 1%, or chromium doesn't lower it at all. The only time that chromium is effective for diabetes is if the diabetes was induced by prednisone. Then chromium is very effective. But if it wasn't induced by prednisone, it's not effective at all. And magnesium, probiotics, stuff like that curcumin is not effective at all for diabetes. That's not to say it's not effective for other things. It's great for other things. Like magnesium is great for constipation. It's good for anxiety. It's good for high blood pressure, but it just won't lower blood sugar. Curcumin is great for inflammation, etc., but it doesn't lower blood sugar. Probiotics are great for digestion, but it doesn't lower blood sugar. So these are the only 4 supplements that lower blood sugar by 1% or more. And again, I'll repeat them: milk thistle, alpha-lipoic acid, ginger, and aloe vera.
Okay, that's great. Thank you for covering that. I skipped that part of it. So this is amazing. Now, all of your books are on Amazon, is that correct?
Correct.
Okay. And how can people, learn more about you, maybe join your program, especially since you have your company online, so you can reach wide audiences? How can people get in touch with you?
So there's my website. People can visit that, www.fitnesssolutionsplus.ca. And if they want to get the first chapter of each of my books for free, which is the myth-busting chapters, for osteoporosis, for this one, just type in www.osteoporosisreversalsecrets.com. For diabetes, type 2 diabetes reversalsecrets.com. And for my high blood pressure book, same thing, high blood pressure reversalsecrets.com.
Oh, that's great. Awesome. And I can include all of those website links in the show notes. So I really appreciate your time with us today. Thank you so much. It's just been a pleasure. You are a wealth of knowledge, and thank you for doing all that research to help people. Really appreciate it.
Yeah, my pleasure. This is a lot of fun for me. I love chatting about these topics, and I hope somebody benefited from this.
Absolutely. And thank you all for joining us today. It was a pleasure to have Igor on. Please go to his website, fitnesssolutionsplus.ca. That stands for Canada. Please go to that website, check him out, look at his programs that he has going on. He has done great work, and he's influencing and impacting a lot of people. So please take advantage of it. Thank you all, and we'll see you again next week. Bye now.